So with this, all these advancements, how early is it able to identify? Is it identified once cancer has begun, or you have a possibility to identify that I am at a risk? Of course, telltale habits. If I'm smoking, I have added a risk factor to me. But genetically, is it possible to identify most cancers as a risk?
So there's something called as screening that is happening these days.
Acha.
So there's even in corporate offices there's a screening protocol or a health checkup, as it is called in layman's terms. So health checkup is nothing but getting your body checked. So there's sonography, ultrasonography of the abdomen. There's chest X-ray. There are a few blood investigations done in people, wherein most of the tumors or the cancer markers are checked, and definitely those can be ruled out. So it is of utmost importance. Even the insurance companies, the medical insurance companies are promoting screening tests.
So they have separate insurances just
Yes.
for cancer, because it can be financially debilitating. And
Yes.
then your 5 lakh, 10 lakh cover is not going to cover a basic
Yes,
cancer.
there's something called as
treatment.
critical illness cover, there's cancer
Right.
cover, many aspects to it.
Right.
But screening is of utmost importance. So right now, a male or a female in 30s is also screened regularly. There's a health checkup once a year. An educated family has a health checkup once a year. So many tumors and many cancer related issues are dealt with during that checkup. If you are smoking, if there's tobacco consumption, if there's something else that is affecting your lifestyle. So according to those habits of yours, the screening is done. So that helps in definitely diagnosing a tumor or a cancer patient in early stages. Yes.
If you remember back in the day, when we were younger and we used to go to movie halls, in the interval, Mukesh was the visual symbolism of cancer. And it was all about mouth cancer, tambaku. And then baad mein thoda sa, I think recently we have seen ads about lung cancer, smoking and air pollution. But the question is, it appears to me from my initial study that the type of cancer is very much prevalent geographically. Different cancers are prevalent in different parts of the world. Like बहुत well-known fact है, Japan में anything to do with GI is a big incidence
Yes.
rate.
Yes.
So as Indians, and Indians is a very broad term these days. पहले से भी है. I mean, we are so different across the length and breadth.
Yes.
Do you have any sense which cancers are more prevalent in India, and are there any geographical pockets that have shown different cancers being more prevalent in these different parts of India?
Yes, there are many details to it.
Acha.
But as we know, the tobacco consumption or the tobacco chewing is rampant in India. So oral cancer is definitely
The largest.
Yes, it is the largest. You can say one of the largest cancers found in India. The oral cancer. Smoking is also a big thing. So the lung cancers are also on a rise, and definitely we find lung cancers in Indians. So if you see the scenario these days, all the cancers are on rise.
Acha.
Yes.
So there's no exception to it. Because I'm seeing a lot of colon and colorectal cancers also becoming
Yes,
more,
yes, yes,
and
yes.
it's happening at a much younger age, it looks like.
Yes, yes. So all these cancers right now are on a rise, all because of the lifestyle changes and the things that we mentioned earlier.
And in women, will it be more apt to say that it's the breast cancer and the cervical cancer that you're worried about, or are there
There's
others?
breast cancer, there's cervical cancer, there's ovarian cancer.
Acha.
So a lot of those
Very, very
cancers
significant in India right now.
Yes. We are getting patients of all those types of cancers these
So
days.
on as we speak about cancers, it looks like the HPV vaccine, the cervical cancer, is the only cancer that seems to have a vaccine. Why is that? Why is that a little different in its treatment?
Now, with advances in medical science, like I said,
Yeah.
they're definitely trying to find a cure
Acha.
for cancer. But every day there's some positive thing that happens, in research, there's obviously there are ups and downs. So we are trying and finding out. The scientists are doing their part, finding out a cure for cancer, and hopefully we'll have it in a few years. Let's hope for the best.
You seem very optimistic. How near are we to that scenario according to you?
It can happen anytime, actually. See, the research is going on since years. There are, like I mentioned, there's positives and negatives to it. There's ups and downs. So whenever they'll find it, they'll bring it to the notice of the people and get it into the market.